everybody, this is Dr. Richard Shuey at Back to Health Chiropractic here in Sonora, California. And I'm into my next video in my series on headaches called Everything You Need to Know About Headaches. And in this video, I'm going to be discussing some of the things that I do to treat patients. Okay, so let's start with, again, remembering the fact that there's a structure in your brain called the trigeminal cervical nucleus. It's this bundle of nerves found right at the hindbrain, and it is the structure that causes your headaches. If that structure is not involved, you cannot feel headaches. Okay? We also know that the anatomists have been able to track the nerves back from that bundle of nerves, and what feeds into it are ligaments, muscles, tendons, and joints that are found in your face, in your jaw, and in your neck region. Okay, structures that are found in through here, that nerves go out to each of those structures, and something is going wrong in that area, and that is creating irritation, which are then sending these wild signals up into that trigeminal cervical nucleus and firing it off, overwhelming it, and then that creates your headaches. Okay, that is how it works. And the way to get over your headaches is to make those structures move more fluidly and correctly so that there's no irritation when you do these activities that you do. Okay? That is what we do in this office, is we work on those structures. And by the way, the neck is going to be the most important structure of them all because it's the one that is probably the most complicated. There's a lot of bones and lots of ligaments and muscles and things that can have things go wrong with it, and the function can be injured or hurt by accidents and just by our daily lives. Our neck is incredibly stressed as well in our daily lives. So that's going to lead to more problems that are going on there. So that's where we are. So how do I treat those problems? Well, what I'm going to first off do is I'm going to do a detailed examination. I'm going to be looking at your posture. I'm going to look at things, how they're pulling on your spine and creating this dysfunctions. I want to look for asymmetries in how you move. I want to look at asymmetries in your posture. Again, if you have tissues that are pulling your spine off to the side like this, that's going to mess up how this neck can move when you're exercising with it. Okay, or when you're doing the things that you do in your daily life. So we want to find out those things, and then I'm going to look at ranges of motion, and I'm going to look what is restricted in those motions, and then we're going to look at those and see what the tissues are that are responsible for that dysfunction. I'm going to palpate your spine, look for muscles that are tender, and joints that are tender, and we're going to see that's where the irritation comes from. And when we know those things, we're going to treat them with the following techniques. Okay, if you have joint problems, I'm going to use the chiropractic adjustment. The chiropractic adjustment is hands down, by far, the most researched and the best way to improve joint function in your spine when there's restriction involved in those areas. And I have two different forms of chiropractic that I like to use when I do so. One of them is manual adjusting. There's a place for that. And so I'll put my hands on your neck and I'll make that pop in your neck when I'm trying to get that joint to move, to gap, and improve the function in it. That's one way to do it. Or I can use the impulse adjusting tool. It's a handheld instrument that's very gentle on your neck, and it's just going to be dependent upon you and your needs, whether I use one or the other with you. First, the problems that are outside of the spine, the muscles, ligaments, and tendons that are pulling from outside of the spine and that are restricted in creating the problems. I'm going to be using something called myofascial release, and I'm going to use the John Barnes approach to it. That technique, I think, I've been using it for over 10 years, and in the 16 years I've been doing this and looking for the techniques that are the most effective at creating these kind of changes these manual changes that I'm trying to do. The John Barnes approach to myofascial therapy is hands down my favorite to use. It's the best to use. It creates really good change in the tissues. Finally, the third thing that I do in this office that really must be done as well is I do rehabilitative exercise. So I usually use myofascial work to work the tissues and the chiropractic to work the joints, and I want to make everything move more fluid. And when it seems that it's going along, so 2 or 3 visits into it, then I'm going to start adding exercises into the routine. Exercises that are specifically specific to your needs in a sense. So if you have a postural problem out here, I'm going to give you exercises that are going to start working you back to a more centered position. I'm also going to, I want to see that those muscles, the weakened muscles, we know that people who have headaches, if you take a group of people with headaches and you take a group of people who don't have headaches and are asymptomatic, they don't have any pain or problems, and you test the strength of their necks, you're going to find that the people who have the headaches have problems with flexion and extension And so those are the areas we want to strengthen in that individual's neck. But you don't want to do that until you free up the proper function of it. So now we've looked at what causes headaches first off, and then we've looked at what is important in correcting the problem and getting rid of your headaches, which is to improve the function of your neck and make it move more fluidly. And we've also looked at some of the therapies that I use in the office to improve the function of your neck, which is chiropractic care for the joints, myofascial release for the muscles and ligaments and tendons outside of the spine that could be pulling in and creating dysfunction in there, and rehabilitative exercise to retrain your core and to retrain your brain's control over these muscles. Now I thought we'd look at some of the results that you might get out of coming in for care. So the first thing that I'd like to say to you is that your results will really be dependent upon our ability to improve the function in your neck. If you have problems with severe arthritis or ligament instability that is really quite severe, then maybe we won't be able to get the results like I'm going to be talking to you about. But really, that's such a small percentage of the people out there that have that problem. And the vast majority of headache sufferers will see good results, as I'm about to say. In my office, it's very common that I have patients that come in with headaches that I see for 6 to 12 visits, and they see a drastic drop in the number of headaches that they have in that amount of time. Usually we'll know within those first 6 visits if it's working, in a sense. So if this makes sense to you, if what I've said through all of these videos, if you can kind of get this big picture and see what is actually causing your headaches, I think you'll understand that the manual therapy is the way to go. It is your best chance at getting over your headaches. And if it makes sense to you and you're getting it, then please call my office, especially obviously if you're in the Sonora area. Give me a call at 533-1201. That's 209-533-1201. And to sweeten the pot even more, I want you to know that I have a new patient special that's $50 for the first treatment. And that includes your exam, that includes any therapies that I do on that first visit. And then after that, it's only $40 per treatment after that for the same therapies that I do in the office. So it's a very affordable and really the logical choice for you to try to deal with your headaches. So please give me a call. Again, it's 209-533-1201. You can leave a message at any time, and I'll get back to you as soon as I get the message. And if you have any questions, you can talk to me about them then.